Hi, my name is Danielle Gunter and I'm a nurse. And being a nurse allows me to function in multiple roles. I work at the local children's hospital, I teach pediatric nursing at a university, and I also serve as that university's clinical liaison. That's the role I like to speak with you about today. There's a nursing shortage across the country, and Texas is no exception to that. In 2009, there was a report published called Texas Nursing, Our Future Depends on It, and it suggested that by the year 2020, the demand for registered nurses would increase 86% from what it is today in 2012. In an effort to reduce this shortage, the Texas legislature passed the Texas Nursing Shortage Reduction Act in the year 2001, and for the past decade, every year they have renewed the funding for this act. However, there are two flaws. It doesn't address the level of education required to practice professionally and successfully in a healthcare environment that is regulated by federal guidelines. It also doesn't address the fact that hospitals are already overrun with the number of students they already have. Right now, hospitals receive reimbursement based on patient satisfaction scores and compliance with federal treatment guidelines, often called core measures. We know that patient outcomes are dramatically increased when the majority of the nursing staff are professionally trained. That means the majority of the staff have at least a bachelor's degree. Facilities are hindering themselves when they are not hiring nurses on the track to receive this degree. The Nursing Shortage Reduction Act was focused on increasing the amount of nursing schools, increasing the number of students enrolled in these schools, and increasing the faculty available to teach these students. It was not focused on adequate preparation for these students or making sure that they have the clinical experiences that they need. That's not fair to them, to the facilities in which they are going to be hired, or to the patients in the communities in which they're going to work. In the last decade, there's been a significant increase in the number of nursing programs within urban areas. However, increasing the number of non-accredited and non-bachelor's degree providing programs does not necessarily equate to increasing the number of nurses, or maintaining a quality, better education for these nursing students. At my facility, for instance, we have not been able to increase the number of students we enroll because we simply don't have enough clinical spaces. We have plenty of faculty and classroom and lab spaces, but we don't have enough clinical spaces to send students into the hospitals and into the clinical facilities where they can learn with patients. Hospitals already have too many students. I know this because my role as the nurse liaison for our university allows me to meet with people at the regional level every month to discuss this problem. Everyone reports the same problem and the same frustrations with addressing this within our community. Students are a burden. They can be helpful, but they are a significant burden on the nursing staff. At any given time, at any given facility, and any given unit, there are students present on the floors. They are a distraction. They often cause more errors from these distractions. They can increase the amount of turnover and increase nursing burnout. This is all significantly costly to the healthcare system. Now, this increase in nursing participation, the increase in interest in nursing, is a good thing for our community, and these students should be commended for their efforts in helping our community. We need them, but we also need clinical spaces to train them. There's a lot of nursing research that says we need to get away from the lecture and theory in the classroom and somehow integrate it with clinical experiences. We need to make the theory real. We need to end the disconnect between the two. Patricia Benner is a big supporter of this. She's an expert in nursing education, and she suggests bringing clinical into the classroom and making it alive. I suggest that in order to do this, we funnel money from the Nursing Shortage Reduction Act within Texas into research programs between faculty and facilities, a collaborative initiative to work on different ways for providing nursing education at the clinical sites without overburdening them. We need to find a better way to produce more bachelor's prepared nurses that can understand patient management and the importance of regulatory compliance, and find a better way to provide positive clinical experiences without overburdening the facilities and putting the brunt of the education on the nurses' backs. We need funds to do this research, and we need people from both the hospital sites, the outpatient sites, and from the nursing programs to work on this collaboration together. We talk a lot about interdisciplinary collaboration. It's time for us to put it in action in this form too, so that we're prepared to address the nursing shortage for the next decade, like we've done for the last decade. Thank you so much for your time, and have a wonderful evening.